Dr. Shannon, what happens when a person, a kid usually, but not necessarily always, I suppose, knocks off a tooth, tooth is missing, there it is laying on a walkway somewhere, it's there, it might not be chipped a lot, but there it is, completely fallen out. And I had once a dentist in the Long Island area who was witness to such a accident by a child. He immediately put a posse of search people together, looked for the tooth, found the tooth, ran with the kid. He was a dentist. He was just down there walking down the street minding his own business. Ran with the kid to a emergency center in some hospital, implanted the thing, and the tooth survived. And the moral of the story is that if your kid loses a tooth, try to find it, try to run to an emergency room and have it implanted because it will regrow again. True or not?
True. It was such a great story. You're absolutely right. I mean, how lucky is that the guy walking down the street is the dentist? But
it's a true story. I didn't make that up.
I'm just saying. I mean, it was perfect. It could have been a mailman walking down the street, and the kid would be walking around with no tooth in the front of his mouth. It was perfect. That's why. So, what you can do to in case there isn't a dentist right there when that happens, yes, you want to find the tooth right away. And interestingly enough, what you want to do is you want to put the tooth, if you have it, depending where this happens, if you have milk available, you want to drop the tooth in milk because protein of the milk will keep the bacteria from forming around it. Now, a lot of times you may wind up needing to have a root canal on that tooth, but that won't keep it from reattaching to the bone. It could need, and then the root canal can be done at a later date. Now, I know a very similar story of what you're saying, and they took the tooth when it was out of the boy's mouth, and they drilled it into the tooth, and they did a root canal on the tooth when it was out of the mouth, and then they put it was in milk for a couple of hours.
They put the tooth in a whisk and start doing it?
Right, exactly. He was holding it by hand, and he did the root canal, and he closed it up, and then he cleaned it off and everything, and placed it. Took him about a half hour to do that out of the mouth, and then he created a little more bleeding in the mouth so that there would be all the necessary things for clotting, and then he placed the tooth up into place and put a little bridge of material that was like a bonding material on the tooth on either side, and held it in there, and that tooth was perfect because later on it didn't need a root canal because it was already done, and they didn't have to worry about an infection and being forced out of the mouth and pushed out again later on. So there's a lot of things that can be done. Importantly, find the tooth. Don't evaluate if it's in good condition or not. Take the tooth, get it into milk, and get to an emergency facility or a dentist. That's if there's a dentist nearby, if it's during working hours where you could, or call somebody on the phone and tell them, you want to meet them at the office, whatever. But get it back into the mouth before the clotting starts to really be a factor. If you go the next day, it's too late because all the clot and all that's forming in there, and it's just not gonna work. You got to do it right away.
Yeah. Well, today with everybody having a GPS phone like an iPhone or this Androids, whatever you call them, you just type in dentist, it shows you 20 dentists in your neighborhood, and you just, touch and call one of them and say, hey, I just lost a tooth, I have the tooth, can I come over? And with no doubt, every dentist, as long as you do get a hold of him, will accommodate you very, very fast.
Sure. Absolutely.
Because he knows the game.
I don't see why not. Yep, good. Exactly. But not all of them know about the milk thing. So if we can reach people with that, that's a good little added extra that putting in milk
exactly.
the proteins.
I actually didn't know about the milk thing. So is the milkman walking by when you knock out your tooth better than the dentist? Or I mean, which one? Or
well, it's certainly better. It's certainly better than the mailman, that's for sure. Because you don't want to mail it anywhere.
You don't want to mail it anywhere.
No. Even priority, it will not get there on time.
I got it. Now, does that principle also work for adults? Or will that never happen with adults? They just break and they don't come out that way.
The bone is so solid in the adult that when there's a trauma, the tooth will snap. With a child, what happens is the bone is still soft, so the tooth is stronger, so the tooth will remain intact, and the bone will open up and widen and kind of split, and the tooth will drop out. So,
got it. Well, Dr. Shannon, Thanks a lot, for the information,
Once again, it's a pleasure.
especially the milkmen. Bye-bye.
Bye.